Welcome to the Fit Girl Magic podcast. If you are ready to find your inner magic, develop great habits, and a rock-steady mindset to feel confident, comfortable, and fit in your body, you are in the right place. I am Kim Barnes Jefferson, and I'll be giving you weekly doses of health, fitness, and life tips sprinkled with humor and real talk. If you're ready to be consistent without the stress of perfection, magic makers, it's time to slip into your favorite pair of PJs, grab some coffee, kick back, and listen to today's show.
Hey, magic makers, listen up. Today's episode is required for literally every human who has ever had a loved one in the hospital or who will. Have you ever felt utterly lost when the doctors throw this medical jargon at you like confetti? You're sitting in the hospital room, they left you with all this medical jargon, and you're just Googling, what the hell just happened? What the hell are they talking about? Have you ever wondered who the hell is actually in charge when 20 people parade in the room and they all look like they're 20 or less? I feel you. Fun fact, and it was very interesting that Dr. Julie Siemers, a nurse with over 40 years of experience, shared with me that over 250,000 patients die each year from medical errors in hospitals. Yeah, that is the third leading cause of death in the United States. Yeah, you heard that right. So I don't say this to scare you. I say this because with Dr. Julie's help, we're going to pull back the curtain and show you how to advocate for yourself and your family without feeling like you're getting the medical steamroll. You will get a crash course in hospital survival 101, and how to spot the red flags, what your real rights are, and how to not just get sent home too soon with a bag of meds and a good luck Charlie. This isn't just about asking questions. It's about asking the right ones. And it's about taking notes, speaking up, and being politely persistent, even when it feels awkward, even in the face of a doctor who's staring down at you with their hairy eyebrows. Your future self and your loved ones will thank you. So let's dive in.
Hey, Magic Makers, it's this week's iTunes review. Amy W. Fitness says, Kim knows her stuff. Keeps it real on all levels. 5 stars. Awesome podcast series on relatable topics that women deal with. Kim's advice, along with her sense of humor, is what everyone needs to find their fit girl magic. Well, thank you so much, Amy W. Fitness. That warms my heart. If you haven't yet left your review, please head over to iTunes or wherever you listen to your podcast and hit rate. And then hopefully it's a 5-star hint and leave me a review. Thanks.
Magic Makers, great show on hand for you today. Think about this. How many of you have ever been in the ER, a hospital, and you're Googling, why your kids won't take meds, why your mom won't take meds, how long will it take for your dad to be in rehab? What does rehab really mean? This episode is for you. I have Dr. Julie Siemers here. And she has been a nurse for over 40 years. And we are going to spill some gossip here about what it takes to advocate for yourself and your loved ones when they are in the hospital. I know personally, my mother-in-law was in the hospital and there was like 20 people that came in the room and you're like, who do I listen to? Who should I care about? And it's really hard to discern what's going on when they're throwing all these terms at you. So buckle up, ladies. You're going to get a crash course in hospital survival 101. Julie, welcome to the show.
Thank you. Thank you for having me.
I love that, here you are, a medical professional, and you realize that us non-medical professionals, we're in, most times you get that call and you're already in a heightened state of like, holy crap. And then the doctors are just throwing all these terms and words at you and you're just like trying to just process it all. What was it that made you say, you know what, I really need to start educating people on how to like navigate this stuff?
Being, as you said, in the healthcare system for a long time and dealing with patients' families and patients themselves and really seeing firsthand how complex it is, how frustrating it is, as you said, especially in those states of high anxiety when you've maybe got a diagnosis you weren't expecting or maybe you just came, had a traumatic accident and you're in the hospital. Nobody ever plans to be in the hospital.
Hey, Magic Makers, real quick before we dive in, can we talk about your metabolism for a second? If you feel like your body has been giving you the finger lately, you are not crazy and you definitely are not broken. You might have a metabolism that is tired AF. I created a fun quiz to help you figure out exactly what's going on with your metabolism and what the heck to do about it. It could be, are you eating too little, overtraining, maybe doing the right things and still feeling stuck? This quiz will call it out. It only takes a few minutes and you will get a custom result that is spooky spot on. So if you're ready to stop throwing spaghetti against the wall and finally figure out how to eat, train, and feel good again, go take the quiz right frickin' now. Link is in the show notes. Let's figure out how your metabolism is holding you back and how to get out of diet jail. So back to the show.
But I think it went deeper than that for me when I started my master's program in 2009. And my thesis that I chose was patient harm. Because when it came across my radar as I was teaching students and sharing stories, because I think that's how people learn through other people's experiences and stories, and realized how many harm incidents happened in a place where we all expect to get healed and improve our health rather than have harm occur. So that's kind of where the idea expanded into, we need to do something about this.
Right. No, and it's interesting how once you kind of peel back one layer, it becomes an onion, and you didn't realize how many layers were in that particular onion.
Oh, yes. Very true.
So let's just start. Someone is in the hospital. What is the obvious mistake that, most of us, make when people are admitted into the hospital?
I'll start with saying it is better to become informed and educated before you find yourself going to the hospital. And I know your show, your audience, and your guests you've had on here is how to stay healthy,
right?
Advocate for ourselves. And that is the best thing that you can do. But if you find yourself in this situation, because face it, we're all probably going to be a patient someday, or our family members are going to be a patient someday. So it really is learn the fundamental 101. So the first thing I would say is, because healthcare acquired infections kill so many people or really impact their lives in a harmful way, the first thing is to just make sure everybody that comes in the room that is going to touch the patient, that they must wash their hands. And so you'll have to find your voice, because we're a culture that aren't used to speaking up or speaking out, right? And so I think understanding the consequences if you don't say something like, please, Dr. Smith, would you wash your hands before you examine my mother?
Right.
That should be expected. We as nurses learn it, healthcare professionals learn it in 101 fundamentals. And we know it's in the literature that healthcare acquired infections still are around and growing. So that would be, I guess, my first tip or two.
Right. I like that. It's interesting because I did notice that, every time, a person comes in the room, there's an immediate sanitation, and it's visible, right? So it's not like this hidden thing that you don't see. Wasn't, I don't think they made it as obvious, but it was obvious that their so-and-so or Dr. So-and-so was sanitizing before they actually touched you. And what I also liked about what you said is being an advocate, because I feel that most times you see that person with the white coat, the stethoscope, and you're like, Dr. So-and-so knows, and you just abdicate your power.
Yes. That is so dangerous. And I'll say that because, again, I'm not trying to throw any profession or any person under the bus, so to speak, but really in this 15 years of investigating this topic and learning, as you said, when I peel back the onion and learn more and more, I'm like, oh my goodness, I had no idea.
Well,
and so really the awareness is my main mission. make everybody aware, and then inform and educate. And I say that because you do have so much more power than you think. And collectively, if we as patients, family members speak up, then the healthcare profession is going to expect it, and they should. We should be working together as a team. That was my TEDx talk that I gave, and it came out 3 weeks ago, was on the breakdown in communication is responsible for 70% of patient harm events. And that's between the healthcare team themselves or patients and their families and the healthcare team. Yeah. So it really is a team approach, and we may have to socialize this to the healthcare profession.
Yeah, no, and you're absolutely right. And the other thing I know I noticed was, you say it's a team, but it's really hard to understand the pecking order, right? Because it's like everyone comes in and they throw all these like literature, and I'm like, I watch Grey's Anatomy for pleasure. I am not taking note of the hierarchies.
Yes.
And so it's really challenging when like they're like, oh, they'll say team, and I'm like, okay, but at some point someone's the captain. Who is the captain? Who am I listening to? Because a lot of people will defer. They're like, oh, yeah, I'm just a nurse, or I'm just the intern, and you're like, well, make the decisions.
Right. That's a really good question. So when we're talking about if you're in the room and you're concerned about your mother, you're obviously going to go to the nurse that's taking care of your mother.
Right, because they come in all the time.
Right. If you don't get resolution there, then you can escalate that to the charge nurse on the unit. Okay. And if you don't get help or somebody to start intervening or taking action, you need to ask for the house supervisor. They're 24/7. And you can take it one step further if you don't get resolution from the house supervisor, is the administrator on call.
Okay.
They're also supposed to be 24/7. Holidays, nights, weekends, it doesn't matter. So finding your voice and using it to escalate, the help that you need or that your mom needs, it is so important and if you can, bring someone with you or have your family with you at all times, because they're an extra set of ears, eyes. The family knows the patient better than anybody, and you can notice those subtle changes, those nuances that a nurse and a doctor that bop in and out of your room, right, they're not going to notice. But those can be early indications of the beginning of patient deterioration.
Right.
So neurological changes, respiratory rate is escalating and staying up there, the heart rate. A lot of these rooms have monitors in there now.
Right.
Those are clues that we can actually communicate and say, hey, something's going on here. Something needs to check.
Right. Yeah. You're right. Because it's like, when someone's in the hospital, you're just sitting there, you might be noticing, you know how your parent, your kid normally is. So there might be a random thing that a nurse who just comes in every 20 minutes might not notice.
Right. Yeah. And those are important things because, again, the literature tells us that before an unplanned cardiac arrest, so a patient declining, deteriorating, those physiological changes happen 6 to 24 hours prior to an unplanned cardiac arrest. So let's just say dad had surgery. 2 hours later, he's got more pain. The pain medication really isn't working. Now we're watching his heart rate go up over the next couple of hours. And now we're watching, his belly distend if he had abdominal surgery. Right. He's looking pale now, maybe now a little sweaty. Those are really clues that something serious is going on. And that's where we need to intervene and say, hey, somebody needs to do something. Something's not right.
Right, because especially after like a surgery, before you have the surgery, they give you the list of all the possibilities. And so as the patient, as someone who's had surgery, as a patient, you're kind of like, is this just from the surgery or is this something new? So you're like, you're so like aware of like, maybe this is a side effect that they didn't mention.
Yeah, you're right. I mean, one of the most common complications after surgery is bleeding. And so that's something that we need to watch for as nurses, of course, but family members too can help. Blood clots are another
Yeah.
really common thing after surgery, and there is preventions that can stop that. And then postoperative pneumonia is pretty common too. So I write about those things in my book, for families. How can you help your family member recover fast and healthy? Just looking at those things that you wouldn't have known about until you're specifically looking, right?
Right. So let's just start, your family member is in the hospital. Do I have a right to know, and they're an adult, so even an adult child or your parent, do I have a right to know what's going on with them?
Yes, you do. Yes, you do. So there's sometimes, it's only the spouse.
Okay.
I think that's the pecking order, as you called it earlier, and adult children, definitely. I would absolutely do a durable power of attorney before I go into the hospital, especially if it's planned, like a surgery or something like that, just so that your bases are covered.
Okay.
That's what I would recommend. Yeah.
And so that way, so like if we don't have that, if, my loved one is in the hospital, and can I say, Dr. Julie, what's wrong with Dad?
Yeah. They should tell you. There should not be secrets about that, because again, we're supposed to be on the same team, right?
Right. So, so there's no HIPAA things that they can't say what's wrong with him.
There shouldn't be.
Okay.
Again, you might have different situations with different hospital personnel at different hospitals.
Right.
But I think that really is, if you can get that sewn up or dialed in before you go, yes, you say, I have the right to if your mom or dad is awake, they can give verbal permission.
Yeah.
But it's when they become maybe unconscious or, in the ICU or something that might pose a problem.
So they have the right to tell you, Dad had a heart attack or whatever. At what point does it become, I'm bound by this HIPAA that I can't tell you certain things?
It is usually on the phone. They say, I can't tell you that because obviously they don't know who you are.
Right.
But if you're there in person and you've established that they're a family member, then there should be no reason that there's a HIPAA problem.
Gotcha.
But I'll give you even before you go to the hospital, and this is in my book too, because I think it's such an important step, choose the best hospital in your area to go to. So there is a website. It's called hospitalsafetygrade.org. And you can go on there, put your zip code in, and see the 2 or 3 or 5 or 10 hospitals in your area. They are rated A through F, just like high school grades or college grades. And it's based on 22 categories and subcategories of patient safety. So if I personally would never go to a D or F rated hospital, their safety is so bad that your chances of harm or even dying are about 91% higher than if you went to an A rated hospital. So I would choose definitely an A or B. And then I would go in and look specifically at the hospital that I'm choosing and see those various categories, and they're red, yellow, green. For example, hospital-acquired infections, MRSA, Clostridium difficile. You can see in there how, if they're in the red zone, I'd be like, well, what are you guys doing because you're doing really crummy, in that area. And then if I'm having surgery, I'm going to ask the surgeon specifically, I see that the hospital you want to do surgery on me doesn't do very well with postoperative blood clots. So what are you going to do to help make sure my mom doesn't get a blood clot after her abdominal surgery?
Right.
That's when you become informed and educated. You can ask those really important questions and be a team member, to help keep them safe.
Gotcha. And at any point, is there like an overall patient bill of rights, like either hospital or is it a federal thing, a state thing?
Every hospital has one, and they're actually based off, it's not a federal thing, although it should be, but it's based off the Affordable Care Act, as well as some of the guidelines with Center for Medicaid and Medicare Services, et cetera. But overall, I've seen the same ones written in many different places, so very similar. But you have the right to information that you understand. So as you were saying when we first started talking, they come in the room and they speak this medical jargon that you have no idea what did they just say and what does it mean. So I would stop that nurse or physician and say, can you please explain what congestive heart failure is? Can you explain what a diuretic is? Can you explain everything they just told you? Can you explain, what is the plan of care here? What are we looking for to know that mom is improving with this plan of care?
Right. And you're right. And again, it's the questioning, like, oh, you shouldn't question the person in the white suit. And you're like, maybe you should, because Dr. Google can only take you but so far.
Right. Well, and the thing is, some of them may disagree with each other.
Yeah.
So this is where I think one of the most important things as family members too, or even patients, is taking notes.
Yes. I stress that to my clients all the time, especially going to a doctor. Like, you have 5 minutes with them before they're like, okay, see you next year. And I was like, don't expect that you're going to remember. Like, if you have something weird happening, start writing all of that stuff down so that you can. It looks like you're sitting there with a notepad and you're like, I'm not leaving until these questions are answered.
Yes. Yeah. And in the hospital, sometimes you'll have a cardiologist and a nephrologist and an internist. And again, we talked about communication breakdowns.
Yeah.
Many times they miss talking to each other and they may give conflicting. And so then again, that's where you come in and say, but this doctor said this. What do we really want to do here? What's the best thing for mom? And the other thing, medicine changes, medical information changes. I think that it doubles every 3 years, and that might not even be the latest statistic. But in that case, if your doctor went to medical school 15 years ago, yes, he's got great experience now, but is he or she up to date on
all the stuff?
Yeah, exactly. And you know what? Honestly, they may not have time to go research. And so I say, you're in charge of your body. You get to decide what is done to your body. And that's where you need to be informed and educated.
And I like that. And, as you said, maybe there is a doctor or a nurse that you don't feel comfortable with. Can I be like, hey, great guy, but not for me. Can you request another doctor?
Yes, that is your right. Second opinions are also your right.
Yeah.
And if your physician gets upset about that, that's the wrong physician.
Yes. Well, and it's funny because I it's not that you're like, I have to make a decision. And you give me something that, like, especially if it's hard news, like you give me hard news and I'm like, I'm already trying to accept whatever it is that you said. Maybe there's someone else who, like you said, went to school 15 years later and knows a different path.
Right. I'll give you an example of why you should always get a second opinion. I do a lot of social media just to inform and to educate. And it was probably about a month ago, it came out, a story in the news of a man who had been getting chemotherapy for 11 years and found out he never had cancer.
Oh, good Lord.
I know. And then it blew up into this whole thing. It was a doctor in Montana who had been doing that to multiple patients. And so you can't just take their word and on trust. It's not, we're not assuming ill intent, but we have to just cross our own T's and dot our own I's just to protect ourselves. Because yeah, he's one in a few that really truly intended harm. But there's many other cases where they just don't know. Right. Or they just didn't understand. Or I'll tell you another one, is to make sure all of your results, your lab results, your CAT scan results, your mammogram results, that you actually see the report.
Yes.
Get it. It's in your medical record. You need to look, if it's electronic, make sure and look in there. You can't assume just because you don't hear anything from the doctor, oh, it must be fine. There's another story in my book of he was a 42, I believe, had children, had a brain tumor, tumor, but they told him and his wife after surgery, oh, don't worry, it looked benign. So when they didn't hear anything, they assumed
He was good.
it was. Yeah. Well, unfortunately, 6 months later, he's got the headaches are back. They do another CAT scan. They find that the tumor is now huge. And then they find the misfiled pathology report.
Oof.
It said, yeah, he did have cancer 6 months ago. So now by the time they're treating it, it was too late. He didn't survive.
Yeah, it's interesting because it's very easy to fall through the cracks, and through no malice. It just really,
Right.
like you said, a misfiling. Like his first name, like someone wrote a P, it looked like a B, so it could easily have been done
Yeah.
that way, or just pure like it got stuck to something and landed in the
Right.
wrong pile, which is unfortunate. But at the end of the day, we're all human, and so
Right.
but it is always like that follow up where you're right, because like sometimes you're like, I didn't hear anything, so I guess I'm good. But yeah, now everything is electronic, so it's really easy for you to do in like a few keystrokes, follow up and be like, hey, I don't know if I got the letter, and look inside and see what's going on. Now, oops, sorry, go for it.
I was just going to say, you made a really good point. Yes, it is humans that make errors, but it's the system that allows the errors. And that's where we need to close the gaps.
Yeah.
Because, and again, that's why we need transparency in healthcare. But unfortunately, 80% of lawsuits that are filed, the hospitals require an NDA,
Yes.
a non-disclosure agreement, which means we're not going to learn.
No. It's not going to be
exactly.
on CNN that the guy for 11 years was getting bad chemo treatments. And,
Right.
and I understand it to some extent, because also then it makes you afraid of everything. But I also think that if this person has been out there, you don't know how good his records were. So like maybe there's someone who is still being treated out there that, they keep doing the scans and they're like, well, like there's still something weird here, and not really knowing like what's going on.
Yeah, exactly.
But yeah, I think at some point, which will probably never change, because you have to cover your own ass all the time. One of the big things I see, especially with my clients, aging parents getting discharged from the hospital. So mom and dad have been there, and I know personally that when my mother-in-law was in the hospital, it was during the winter, and they're like, she's 90 years old. You want her the hell out of here because of, COVID, pneumonia, any possible thing that you talked about, hospital-borne illness. So, are they really pushing people out the door before it's safe for them to leave?
Yes, they are in many places.
That was not the response I was expecting.
I'm sorry.
I love it. I love the brutal honesty. I love it.
Long gone are the days that the physicians could make those decisions. Now they're being overridden by not just healthcare insurance companies, but AI technology.
Right.
I just wrote about that the other day because it came across my feed like 3 different times in the news lately. Now there's lawsuits because of patients dying because they left the hospital too soon, despite the physician saying they needed longer in a post-acute care. But these insurance companies are denying based on an AI algorithm, which I love AI. I mean, it's fantastic. There's a lot of great stuff with it, but we've got to use it judicially, and it should not override a physician's medical training and experience.
Right. If Sharon can't stand up, then Sharon shouldn't leave. Like, there's the couple of surgeries that I've had, there's been like 3 things that I had to be able to do on my own in order to be able to leave the hospital. Like AI is not going to know. It's going to say, oh, well, she's a X number age person, these no comorbidities. She should be able to leave in 20 minutes.
Right.
But it's like, if I can't stand up, I can't go to the bathroom on my own, like I should stay till that's all rectified.
Yes. Even something as simple as there was a woman who was in the hospital for heart dysrhythmias, and they were trying to regulate her medications. Well, she was discharged with a heart rate of 127. Normal heart rate for adult is 60 to 100.
Yeah.
And usually it's around 60 to 80. Well, when your heart is beating that fast, the ventricle doesn't fill as properly as it should. So the amount of oxygen getting to your brain, getting to your vital organs is decreased. She fell in her driveway on the way home, or trying to go home, had to go back because now she had a vertebrae fracture from falling in her driveway. There's nobody that should be discharged with abnormal vital signs. So it's even that simple that could be that catastrophic, right?
Right. Because you don't even know, like, if your heart rate is double what it should be, is it a medication issue? You know,
Right.
Is it some other complication that's starting to like rear its head? And if, God forbid, she lives alone.
Right. Yeah. It's so scary. It truly is. And that's why I say the more you can learn about your body, how it functions, and your family, and know what's normal.
Right.
And use that voice to say, no, I'm sorry, mom is not going home.
Right. Well, especially, you know, one of my good friends, her mom broke her hip. And so she's like, you know, going to be down and out for a good 8 weeks. And she's like, look, she goes, I have stairs, I have this, I have this. She's like, we need to work through options because she, you know, like you told me she can't be here by herself. And so he's like, she goes, what am I supposed to do? You know, for a lot of people, you're in a rock and hard place because, you know, fortunately she lives in the same state, but how many kids live thousands of miles away from their parents?
Yeah, it's tough. It's hard to be alone in healthcare these days. I don't recommend it.
No, it is very hard to be alone in healthcare. And so as we're talking about that, you know, you kind of hit on that there should be some type of power of attorney before, you know, anything happens. At what age should you have this medical power of attorney?
I'd get it now, no matter what age you are, only because we just never know what's going to happen.
Gotcha.
You know, and again, we're not trying to be pessimistic. I'm a really optimistic girl, but we just never know what's going to happen. So just have it on file with your family, your kid, your parents, so that everybody's covered just in case. It's always better to be proactive rather than, oh dear, what do we do now? Yeah.
And so the question I have with a power of attorney, so that, you know, one of the things that I've heard is that, you know, your kid goes off to college. And so, you know, they're in another state, you're in another state, that, you know, just the whole medical treatment pieces of like, you know, if they're asleep, if they're, you know, they're unconscious, you know, can you still make decisions without that piece of paper?
Yes, it would depend on the state, the child's age. I mean, there's probably factors there, but I think it really is your only safeguard just to say,
have that.
I have it. And it's simple. You can download it off the internet on a free form, you know, website or whatever, and just get it notarized. You'll be good.
Well, you know, it's funny because I think as a parent, you're like, Stevie, he's 18. Like, what's the big thing? And you're just like, that's an adult.
Yeah. There was a young man a couple weeks ago who, it was actually in December, but his parents filed a lawsuit, who takes an asthma inhaler every single day for most of his life. He was 22. His insurance coverage, he was paying $66 out of pocket. It jumped in January to $569, and he couldn't afford it. And 3 days later, he was dead. He had an asthma attack that could not be reversed or saved quick enough. So even as an adult child, you still may be in that situation where you still need your parents or, you know, your family member to be able to make decisions for you.
Yeah. When I first hear those stories, I'm like, you know, there's a human attached to that, right?
Yes. That's every time something happens like this, it's somebody's mother, father, sister, brother, everyone. Yeah. You know, and when the decisions are being made, like with these pharmacy benefit managers to raise medication prices like that, I'm like, do you understand the harm that you're doing? Potentially. I mean, there's so many people now that can't afford their medications.
Right. And I shouldn't have to choose.
No, that's a travesty to me.
Yeah, it is a complete travesty, especially because you're like, I do a lot of work with biomedical companies, and I'm like, I get the first few years, it takes millions. I understand that, but at some point, why did it go from $66 to $500? Did you come up with some space age polymer that you put inside of it now? Like, give me a justification for why it's new and improved that it has to, quadruple in price.
Well, from all the news that I've been reading on that, pharmacy benefit managers made an excess of $7.4 billion in the last 5 years.
That's crazy.
It's just greed and corruption.
Complete.
I'm sorry to say.
No, it is. Because especially when you look at other countries that, half the drugs that we pay oodles for, they're like, oh, you could get that at CVS. Like, so it's really crazy about that. So we have the power of attorney, but there are also times that there might be need for other people to be involved. So like maybe you're a grandparent, so maybe, and the parent's incapacitated, so there might be children involved. Are there like other services that you can or might be thrown upon you?
Yeah, I would just consult an attorney, honestly, just to say, given the wild and wacky world of what ifs, how can we best make sure that our family has the right documentation so that we have the rights to help our family member if they're incapacitated?
Right.
That's the best way to go about it.
Perfect. And so now, we're going back to the discharge. How do I know that, they're like, going back to my friend's mom, she had to be the pusher to get her into a rehab facility. So how do you know if it's a nursing home, a rehab facility, or they're just being pushed out too soon?
The caseworkers should be able to do that. The case managers at the hospital, they have a specific role that is what they're supposed to do, is assess what the functionality is of the patient and then determine which facility is best suited for, most of it's probably rehab, unless it's going to be super long-term care.
Right.
But like, yes, a broken hip definitely would be a rehab place. They should be taking care of all that. Again, the family member may have to say, put their foot down and say, I can't take her home. I've got stairs.
Right.
There's nowhere for her to be. Understand the situation and then say, help me understand why you think this is a good idea.
Yeah, exactly. Yeah, like, and if you think it's a good idea, well, what's your living situation look like?
Exactly.
So now if I know that I'm going to the hospital, is there anything that I should prepare, other than make sure the power of attorney is there? Is there anything should I prepare to bring with me to the hospital just to make sure that I have it, other than my own pajamas?
They won't even let you wear those.
Yeah.
I do have a free patient safety checklist that I can send you, and you can attach it in the show notes for your listeners. But I would say your list of medications, usually they won't let you take your own medications there, but if they know what you're on already, is probably about all you're going to be able to. I'd leave everything else at home. Your watch, your rings, your jewelry, obviously bring your phone so you can communicate with your family members. Yeah.
Right. So just basically bring yourself. And is there like, for someone listening, like what's like, one piece of advice that like you would give to everyone?
The two I like to share is the 3 Ps. So be present, be polite, and be persistent. So be present when the nurses are making rounds or giving shift report, during change, or when the doctors are making rounds if you can. But to me, it also means be present in your heart, have good intentions, and assume that you're going to work well together with the team. And then be polite, even though it's hard sometimes when you're really frustrated. I know most facilities are understaffed with nurses. Yeah. And so they're probably running around like crazy. And so just being polite. Hey, I've asked 3 times. My dad needs his pain medication. How can we make that happen? I know you're busy. And then be persistent. If you are concerned about something and you're not getting intervention or action or resolution, like we talked about before, but the cuss words, not what you think it is, are words that you can use when you really need to get someone's attention on the healthcare team. So I'm concerned, I'm uncomfortable, I'm scared, and this is a safety issue. So if you use one of those terms and then back it up with your evidence, I'm really uncomfortable with the amount of pain my mother is in. This just doesn't seem right. She had a pain pill an hour ago and she's writhing. Something's not right. You know, that kind of thing.
Yeah.
Those are kind of keywords.
No, and I like that because it's like, you know, you helped us kind of like break through the like medical curtain as far as the words that like, you know, you hear concern and then you're like, oh, let me perk up a bit, you know, versus like mom's in pain. And then you're kind of like, well, how much pain is she in? Like, you know, so then it becomes this multiple questions that the nurse has to ask. But if you start with concerned or she's uncomfortable, then they're like, okay, what does that mean? You know, understand what that means. Yeah. Now, this is one thing I've heard, but maybe it's not true anymore. You should avoid hospital stays on the weekend.
Typically, hospitals are less staffing on the weekends. Doctors aren't as available on the weekends, it seems. There may be somebody on call covering for your physician, so they may not know your son, you know,
the true story,
your family member. Yeah. Exactly. And then you've got to catch them up with, yes, but, and that's where your notes come in. Good. Right. There are studies that definitely say more harm happens on the weekends. So if you can get your surgery done or whatever you're going to do at the beginning of the week is probably a little bit better.
Right. Then have it, you know, because most people book things on Fridays. They're like, oh, I have the weekend to recover. But, you know, just in case something goes awry.
Right. Just to know.
Yeah. Just to know. But yeah, this has been really like enlightening. And I think my biggest takeaway is this, the notepad and the questions, so that when the doctor is talking to you, he's not saying you're just relying on your memory. Like you're like, I physically wrote it down. So I'm like, making sure I know that. So I really think that is paramount. And so I ask everyone, where can we find you on the socials? And you've mentioned your book a couple of times. So I also want you to talk about your book and also your TED Talk, which I will link in the show notes.
Wonderful. Yes, my website is drjuliesiemers, SIEMERS.com. And most of my socials are drjuliesiemers as well. And then my book is on Amazon. It's called Surviving Your Hospital Stay, A Nurse Educator's Guide to Staying Safe and Living to Tell About It. It's got 30 stories in there, which as I said earlier, I think people just really relate to. Oh my gosh, that happened to them. Now I know better how I would maybe react in that situation. Yeah. And then my TEDx talk is, and I can send you that link too, is titled How Not to Die in the Hospital.
And I'm like, I go like, that's just a great Google, like how do like that's something someone's going to be thinking about when their next hospital stay, like how not to die and you pop up.
Yeah, in that TEDx story too, the TEDx talk, I give 3 stories of patients that did not survive their hospital stay, even though their families did try to speak up. And so I think when we see that and hear those stories, and unfortunately they're way too common, then it gives us the power and the courage, I think, to speak up. Because if you don't, what may be the consequences?
Yeah.
And that's what's scary, you know?
I mean, the big thing you said was, you know, speak up, and that you're like, you know, be polite, like just be like, hey, I don't understand. And, you know, no one's going to, you know, chastise you if you're like being polite about it. But if you're like, hey, buddy, like cut the crap, you know, they're going to be like, oh, it's going to be a note in your file.
Here's kind of the last thing I want to leave with you is over 250,000 patients die every year from medical harm. If we compare that to the airline industry, which, yes, I mean, this mid-air collision in my backyard, I live right outside of DC, only in the last 2 decades, and I say this in all reverence to the families that lost these people on airline crashes, but it was only 269 in 20 years. We're talking about over 600 a day.
Wow.
So with that in mind, and that's the harm is even bigger than that. That's just the deaths. So that's why I think we need to break the silence. We need to, as you said earlier, I love it. We've got to pull back the curtain. I call it the Wizard of Oz curtain of healthcare. It's just got to be pulled back, and we have to have transparency.
Right. I agreed. I mean, like you mentioned earlier about all of these lawsuits and the whole NDA, where it's like, if you were on CNN because, whatever you did, more people would be like, oh, hang on, maybe I should ask more questions. Maybe I shouldn't just blindly trust.
Yeah, so find the courage and the confidence, people. I know it'll make a difference in your loved one's life.
I absolutely love it. And Julie, I ask everyone before I wrap up the show, what's one thing that makes you feel magical?
What makes me feel magical is helping other people. Sharing my knowledge, sharing my experience, and just hoping this doesn't happen to anybody else.
Yeah, no, you're right. And I think, like you said, listening to your TEDx talk or even reading a book, it just helps you kind of bring awareness to all of the potentials that are out there that you're like, wow, I never even considered that. Now it's considered. And
right.
And hopefully if it does, it does cross your path, you were more informed about hearing these patients' stories.
Exactly.
All right, Magic Makers, this is a must listen to. If you are juggling aging parents, adult kids, your own health, know how to take control of your hospital experience. Grab Julie's book, Surviving Your Hospital Stay, and go through it. We talked about that medical power of attorney. Get that right now. Get that all in order for your entire family, so that we're not in a surprise when we get that oh my God phone call. All right, Magic Makers, I will talk to you next week, and enjoy the rest of your day.
Thank you for listening to the Fit Girl Magic podcast. If you've made it this far, yay! I'm thinking you enjoyed the show. Let's continue the conversation on Instagram. You can find me at Kim Jefferson Coach. In order for me to keep sharing this message, do me a favor and leave me a 5-star review on iTunes. While you're there, don't forget to subscribe so that you won't miss an episode. New episodes are available every Wednesday. The Fit Girl Magic podcast is intended to provide you with tips, tools, and strategies that will help you make better decisions about your health. I really appreciate your feedback and your support. Thank you so much.